Good morning, dear students. In continuation of our study anatomy, today we are in part 10, where we will study about the joints, its classification with example. It's very important for you. It is very frequently repeated as theory long question. Individual types of the joints can come as short note, and starting from now, the first professional MBBS, until your postgraduate entrance also. The individual joint with the classification and examples can come as MCQ everywhere. And this is the basic. So you have to learn very meticulously without a single knot in your memory. Anything, anywhere, finding any difficulty, please write to me. I will answer. Okay. So to start today's presentation, before starting on to any of the new topic, my dear students, please revise your old, as the topics are very much closely related. And if your previous knowledge is crystal clear, then the new one will come very easily onto your memory. Let's revise on your mind. We have till now covered the sub-branches and methods to study anatomy, anatomical position and related terms, very, very, very important. Skeletal system, cartilage and bones, their general anatomy. We have studied bone growth and ossification, bone markings. In revision of all of this, the last one, the bone markings, take your bone sets along with you. Confirm each of the examples with your feelings, vision, knowledge. Thus, it will be impinged onto your memory. In this presentation, the current one, we will deal with the joint and the classification with example. The joints are the articulation or the connection between two or more bones to allow movements. So also to bring the adjacent bone together. So to define the joint are the articulations or the connections between two or more than two bones, and it's a device to allow movement of the bone. Exception is there where the joints are immovable too. Long bones articulate by their ends, flat bones by their margins, short and irregular bones by their surfaces. Coming to examples. Picture, this is a picture of the knee joint where two long bones, femur from above, tibia from below, articulating to form the knee joint. Here it is the skull suture, the sagittal one, where two parietal bones are articulating at their margins. This is the region of the carpus or the wrist region where the small bones known as the carpal bones are articulating among themselves via their surfaces. These are the two vertebrae articulating between themselves via their surfaces at their articular facets. Again, an irregular bone, the hip bone, articulating with the sacrum, one from the each side, the hip bone articulating with a single sacrum to form one of the stout joint of your body known as the sacroiliac joint. Now coming on to the classification part of the joint. Joint may be classified in different ways, one of which is as per the number of the bones coming to form the joint. As we have said that the joint can be formed by two or more than two. Depending on that, it may be a simple joint when two bones via their articulating surfaces are meeting one another. Compound when the participating bone numbers are more than two. Complex is another variety, not directly connected to this number part. But here the joint cavity is divided partially or completely. When it is a complete division by an intervening articular disc, and when it is an incomplete division of the cavity via meniscus. Coming to the examples. See, these are the metacarpals. Metacarpal articulating with the proximal phalanx to form the metacarpophalangeal joint. 1:1. So this is an example of simple joint. Elbow joint, where the humerus from above, radius ulna from below, total 3 bones, more than 2, articulating to form the elbow joint. Thus, it is an example of a compound joint. Coming on to the complex joint, directly not numbered, 2 bones are coming, but the joint cavity is divided into 2 parts, completely by presence of an articular disc. So this is an example of a complex joint. Some more examples coming to knee joint, the joint cavity incompletely divided into 2 parts via 2 meniscus from the both sides, medial and lateral meniscus. And this is again a complex joint. This temporomandibular joint, the only mobile joint of your skull, where the condyle of the mandible is articulating here at the glenoid fossa of the temporal bone. And this joint also divided by an articular disc. Here is an acromioclavicular joint. Here is sternoclavicular joint. Both are divided via the articular disc into 2 halves, the cavity. So these all are the examples of the complex joints. Now classification of the joints depending on their functions. Depending on their functions, they are divided as synarthrosis, amphiarthrosis, diarthrosis. Though some authors do consider the synarthrosis and amphiarthrosis under the single heading of being synarthrosis. Syn and amphiarthrosis both are the joints. They are different from one another at the architectural point, so also their functional point. Architectural point is that here in synarthrosis, the articulating bone are articulating between themselves via fibrous tissue, such as sutures, allowing no movement or very, very least movement. And in amphiarthrosis or cartilaginous joint, the articulating bones are articulated via intervening cartilage, and they are less movable. Saying to diarthrosis, diarthrosis meanings to synovial joint, having synovial cavity, membrane, and a different structure, a complete structure of a joint. So that sort of joint allows wide range of movement. Most of the joint in human body are diarthrosis or synovial joints. Synarthrosis or fibrous joint, this arthron word is Greek origin. It was first coined in 1578. It says of the joints which are least movable, examples are sutures, syndesmosis, gomphosis. Coming in details. Amphiarthrosis or cartilaginous joint, where the cartilage is converted to bone in later age or not. Depending on that, they are the joints which are known as synchondrosis or primary cartilaginous joint and secondary cartilaginous joint. This word syn or sim, meaning to be together, is coming from Greek. Diarthrosis or synovial joint are the most movable joints, and as it is a single big topic for discussion, I will cover whole of it in next presentation. So keep an eye on it. These are the examples of some of the synarthrosis. These are the cranial sutures. This is symphysis pubis, an example of amphiarthrosis or cartilaginous joint. This is an example of the synovial compound joint, the elbow. Now, synarthrosis or fibrous joint. They are of 3 types: sutures, syndesmosis, gomphosis. Sutures are mainly seen in skull bones, mainly in those bones which ossifies in membranes. Syndesmosis meaning to articulation of 2 bones lying in close vicinity one another through interosseous membrane. Get the term interosseous, lying between 2 bones. Gomphosis, the gomphos word meaning to tooth. So the tooth joint, the tooth lying in the tooth socket, they are articulated via the fibrous tissue, is a type of joint known as the gomphosis. Simple word suture, you mean the suture of your tooths, where similar parts are brought together, they are united at one point. These are the different sorts of stitches. And with the practical utilization of all of this handwork in human life, in closure of your wound, closure of the surgical incision following surgery, we do give suture where the adjacent or similar parts are brought together via some suture material. It will look like this after the suture. So from the same word, same meaning, the nature came. It is the sutures, meaning to sew or seam. As it's been already said that these are seen mainly in skull bones, those bones ossifying in membrane. And they develop in the region of the unossified sutural membrane. Sutural ligaments are connecting adjacent bones. And in later ages, after 25 years onward, the line or the sutural membrane is converting to bone. So it is synostosis now. This is the architecture of any of the sutures. You can see the bone divided in two plates, outer, inner. So also in this case. And here they are articulated via the sutural membrane and the ligaments. This is a rough architecture of the region of the suture, where you can see two developing bone developing in membrane. At the region of the sutural membrane, there are two osteogenic font which are proceeding to one another. Intervening part having vascularity and the sutural ligaments connecting the osteogenic fonts so that the suture is formed. And in later age, this osteogenic font all either may be overlapping, interlocking, and getting converted to bone, leading to synostosis. Same picture in some other way depicted osteogenic font and the region of the sutural membrane having mesenchymal cells, vascularity. This is a neonatal skull where you can see different island of membranous model converting to bone. And they are proceeding from center at one point to the periphery. In case of frontal, it is frontal tuberosity to their all surrounding. So also in case of parietal, from parietal tuberosity to all surrounding. So at their meeting point, by the time of birth, it is remaining membranous. And they will get converted to sutures in this format. And in adult life, ultimately this configuration is acquired. And even in much more older ages, these are also converted to bones by the process known as synostosis. These are some of the sutures and the different views of the skull. This is the coronal suture. This is the location of the sagittal suture. This blue one is the lambdoid suture. This is squamosal suture. Again, the same thing from anterior view, from posterior view. Now, how the sutures look like? Depending on that, they are divided as serrated suture, denticulate suture, squamosal suture, plain suture, wedge and groove sutures. Get the examples of all of this, and this is a very important slide because any of them can come as your MCQ. So also short note. Read it very carefully. Serrated suture, meaning to the edge of suture is having serration of this short tooth like. So from there, the similarity and the example of the serrated suture is the sagittal suture. The sagittal suture formed between two parietal bones at their superior border. This is an example of a denticulate suture. See at the suture line, the parts of the bones they are contributing to form the suture. At the suture line, some areas, the part impinging, are narrow at the base, wide at the apex. Here also see narrow at the base, wide at the apex. So as if one denture tooth is articulating inside the another one, like this finger inside another finger. So from there, the name came, it is known as the denticulate suture. Example is the lambdoid suture formed between the posterior border of the two parietal bones with the occipital bone superior border. Now the word squamosal suture. This is the architecture format for serrated and denticulate suture. But in squamosal suture, there is no one finger inside another finger locking. It is overlapping of a surface onto another. The scale-like part or the flat part of any of the skull bone is said to be the squamous part. So the squamous part of the temporal bone in the region of the temporal joining with the parietal inferior border is overlapping. The squamosal part of the temporal bone is overlapping the inferior border of the parietal bone. And this is the squamosal suture. Plain suture, see here in the formation of the heart palate, it is contributed by the palatine process of the two maxilla. And from posterior part, the horizontal process of the two palatine bones. All of them are articulating with one another, not in interlocking manner, not in overlapping manner, but they are just meeting edge to edge. So that sort of suture is known as plain suture. Wedge and groove suture. If you think of this word scintillasis, coming from the word scintillasis, which is derived from Greek, when an axe is impinged on a log to cut it, it will look like this. So from there, the word wedge and groove suture or scintillasis has come. One such example of suture is at the base of the skull to form the posterior part of the nasal septum, where the rostrum of the sphenoid will meet the groove of the vomer. Here it is the nasal septum and this is the plate of the vomer. It bifurcates here in this manner and forming the groove inside which one rostrum from the inferior surface of the body of the sphenoid get articulated. And this articulation is fixed via here fibrous tissue. And this sort of suture is known as the wedge and groove suture. These are the classification of different types of suture just been said. Revise once in your mind. Syndesmosis. The syndesmosis meaning to articulation of two bones via their surfaces or borders over a long area through interosseous membrane or ligament. Must remember that the ligament persists lifelong. They allows only slight bit of movement. Examples are the inferior tibiofibular joint, interosseous membrane connecting the interosseous border of the two bones of the forearm, that is radius and ulna, ligamentum flavum, which is articulating the lamina of one vertebra to the other, the upper vertebra to the lower vertebra. And this flavum is a Latin word meaning yellow because the ligament itself looks yellow. It has an increased elastin content than the collagen. This is the inferior tibiofibular joint. You can see the interosseous ligament. It is proceeding onto the upper part also. This is the vertebral column where part of the bodies of the vertebra has been removed to show the ligamentum flavum. which is connecting the lamina of one vertebra to the lamina of the other vertebra. So you can see these are the fibrous joint under the heading of syndesmosis. Gomphosis. Gomphos meaning to tooth. This is another word said to peg and socket joint, as if one peg is fitting inside the socket. The roots of the teeth fit in the socket of the jaw, either upper or lower, and they've been fixed by fibrous tissue. See, this is the bony socket for the tooth, where the tooth is received, and to the socket it has been fixed with the fibrous tissue, as they are lying on the peripheral part of the dental. That's mean tooth. So it is periodontal membrane, and this is known as gomphosis. Amphiarthrosis or cartilaginous joint, meaning to those joints where articulating surface of the bones are articulated via presence of cartilage. So it is cartilaginous joint, allowing very minimum of movement. Here again, it is divided into two types. One is primary cartilaginous joint or synchondrosis, and one is secondary cartilaginous joint, what is known as symphysis. In case of primary cartilaginous joint, such as epiphyseal plate, by this time you know that the long bone is ossifying from one primary center for the diaphysis and secondary centers appearing at the end. Suppose this is one of the secondary center from where the epiphysis part is ossified and the primary center proceeding to complete its ossification. So at the region of the epiphyseal cartilage, the cartilage of the both regions meet, and this is the zone of the growth plate, which allows the growth of the diaphysis in length. With time, this growth plate is replaced by bone, and it will be a continuous structure, continuous bony structure with no intervening cartilage at all. So this sort of joint is known as primary cartilaginous joint. What is the difference between suture and synchondrosis? Is that in sutures, we are getting, this is the connecting part, it is via the fibrous tissue, mainly occurring in membranous ossification part region, or membranous ossification having bones. But in synchondrosis, it is the articulation between two cartilage, and depending on whether primary or secondary, it will convert to bone or not convert at all. This is another example of a joint having the primary cartilaginous joint between the basi occiput and the basis sphenoid, remaining cartilaginous, fused by the age of almost 25 years. And this is the bone, or this is the region which allows the anteroposterior growth of the base of the skull. The first chondrosternal joint. The anterior part of the ribs is remaining cartilaginous. Manubrium is a part of the sternum. So this is the first chondrosternal joint, as there are other chondrosternal joints too. Ribs are 12 pairs. So the first chondrosternal joint is considered to be a primary cartilaginous joint, but there is controversy regarding this to be a synovial joint also. There are evidences too. So this is, though exclaimed as a primary cartilaginous joint, recent evidences said it to be a synovial joint. Secondary cartilaginous joint or symphysis. The criteria of this is that the two articulating surfaces which meet one another. Take this one. Symphysis pubis, where the articulating surfaces are the body of the two pubis, which are covered by hyaline cartilage, and with the intervention of a piece of fibrocartilage. And this fibrocartilage remains as it is lifelong. There is very little allowance of movement. So this is secondary cartilaginous joint. One exception is the joint between the two halves of the mandible formed anteriorly over the region of the mentum. Though they are articulating, they are lying over the midline as the symphyseal joint or lying over the median plane, but they are later age fused and the cartilage has been converted to bone. So this is symphysis menti by its position, but it is not actually a symphyseal joint. Some more examples of the symphyseal joint are the joint between the body of the vertebrae, where it is articulating via the disc of the fibrocartilage known as intervertebral disc. A very important fact about the sacrum, coccyx, like that, you know that the total count of the 33 vertebra has come down to 26 because the 5 sacral vertebrae unite among themselves to form one. But their body articulation at the region of the bodies of the first, second, third, fourth, fifth sacral vertebrae, all they are articulating, forming bone at the periphery, but at the core, they lie as cartilage lifelong. So also in case of coccyx too. So these are the examples of secondary cartilaginous joint. Though appearance-wise, it will look little different, but they are secondary cartilaginous joints. Another very nice one is this manubrosternal joint. Manubrosternal joint is the joint on the anterior part of the chest between the manubrium and the body of the sternum. In case of respiration, there is forward movement of the sternum along with backward movement during inspiration and expiration to increase and decrease the diameter, anteroposterior diameter of the chest. And this movement is occurring here at the manubrosternal joint. And see, this movement is similar to the movement of the pump handle. So this respiratory movement is named as the pump handle movement. The joint is lying over the median plane. It is mobile, having cartilage inside. So it is again an example of a secondary cartilaginous joint. Though later in age, after 40, one after 60, can fuse. But even here, the core part is remaining cartilaginous. This is gist of today's presentation. Go very quickly. Make your own note. Make your own picture. Because any of the other thing other people will teach you, all are book-like. And mainly the online presentations. That will help you. But you have to make it your memory. So write down in your exercise book. This all presentation will help you. But this is not exclusive. Until you are engulfing it, you are imprinting it onto your memory. Okay. And in next presentation, we will cover this part, that is synovial joint, which is a bigger topic with lots of classification types and shape, as most of the joint of our body are synovial joint. We will cover it in our next presentation. Okay. Till then, happy learning. Be good. Thank you.